So this video is going to be for the type of back pain that you have, which is when you bend forward, you get your back pain, or when you sit, you get your back pain. So the first thing to realize is, although we might go in a certain direction for initial treatment, both directions, bending forward and bending backward, are really good for your back. The back really thrives on a variety of different types of movements, so it's important to keep that in mind. So for the first exercise, you might be at beyond the level of the initial exercise, so feel free to start on this progression however you would like, whatever fits your current level that you're at. So the first one's going to be some extension this way, where you're going to just be relaxing your hips and shaking them out as you come down. If that's easy, what you can start to do is put your hands on your hips, and you're going to be bending backwards. That way you can bring your head all the way up to the ceiling and look up. Try to get as much as you can. You don't want to bend your knees too much. You can try to keep them straight. Get full extension. And then simultaneously, what you can start doing is start to do these exercises where you're literally bringing your hips back to the wall. And the idea is we're just going to keep our chest up and just let our hips touch the wall and come back. The next phase is going to be balancing on one leg, and you're going to bring your hip back and touch and come back up again. So you're teaching your legs how to absorb all of the weight, because the muscles in your legs are huge, the muscles in your back are very small, so you kind of want to get some of your leg muscles strong to be able to be a little bit more functional. And then what you can do after that is progress to some of these exercises where you're going to be loading your back more. And then you can work on loading on one foot, so that will look like this. And when that looks good, you can run and start to not think about or not be cautious about how you pick things up anymore. So if I'm picking up this chair, instead of trying to be all straight and perfect and lift like this, I'm basically just going to lift it up in whatever way that I see fit. So it's important to not think about our back when we lift, because we don't think about our ankles when we lift, we don't think about our elbows when we lift. Ultimately, pain completely going away and us being back to normal health is not continuing an exercise program for our back, and not thinking about it when we engage in the world and do specific activities. So that is a sign of complete recovery or complete back health. Now, it is very important to prevent back pain by doing exercise, but when we're running, lifting weights, keeping ourselves conditioned, sweating a few times a week, doing intense exercise, it's important to do that for our overall health, but it's not like I'm doing this for my back pain. It's more just I'm doing this for my overall health. So it's important to do exercise. It's just we try not to think in our minds, well, I'm doing this exercise for my back, because long term you shouldn't need to do an exercise program for that specific region. So if you have questions about any of this, feel free to ask us in the questions and comments box. If you want us to look at your form, feel free to upload a video showing us what your exercise looks like, and we can give you feedback on a daily basis. All right, thanks so much. Good luck on your recovery.